A very pleasant morning to one and all. In previous class, we have discussed about the sodium ion potassium pump, ECG, EEG, and the block diagram, and why we are using the ECG and EEG. Now we can discuss about the electroencephalogram. The output graph of an EEG typically consists of three series of wave lines known as brain waves. The brain waves are divided into several frequency bands which are measured in hertz or cycles per second as delta waves, which can in the range of 0.5 to 4 hertz, and these waves are the slowest and represent deep sleep or unconsciousness. Theta waves, which can range from 4 hertz to 8 hertz. These waves are associated with drowsiness, daydreaming, and light sleep. And alpha waves, which represent the range from 8 hertz to 12 hertz. These waves are present when the eyes are closed and the person is relaxed or meditating. Beta waves is ranged from 12 hertz to 30 hertz. These waves are present when the person is alert and focused and can be further divided into low beta and high beta. Low beta is ranged from 12 to 15 hertz and high beta ranges from 15 to 30 hertz. Gamma waves ranges from above 30 hertz. These waves are associated with high levels of concentration, problem solving, and cognitive processing. And electromyography and EEG stands for electromyography, which is a medical test that measures the electrical activity of a muscle and the reserves that control them. In this test, the small electrodes are inserted into the muscles being studied or placed on the skin overlying the muscles to detect and record the electrical signal produced by the muscle activity. The EMG test can be used to diagnose various neuromuscular disorders including muscle disease, nerve damage or injuries, and disorders affecting the spinal cord. It can also be used to evaluate muscle function before and after surgery or other medical procedures. EMG is a safe and minimally invasive test that typically takes around 30 to 60 minutes to complete. Depending on the number of muscles being studied, the test may cause some discomfort or pain, but this is usually mild and temporary. EMG results can provide important information for diagnosing and managing various neuromuscular disorders. And the EMG block diagram, a body part of the muscles is connected to an EMG electrode, which is then converted to an amplifier to amplify the signals from the electrode. An electrode can measure only a small amps of signal from the muscles, which can be boomerized by amplifier, which can be connected to the EMG recorder, through which we can connect to the oscilloscope and amplifier to which the amplifier is working or not, and also to EMG recorder we can get the output. An EMG, the out graph of an EMG typically displays the electrical activity of the muscles being studied as a series of wavy lines. The graph is usually displayed on a computer screen or printed on paper and can be analyzed by a trained healthcare professional to detect any abnormal patterns or activity. The EMG graph will typically show two types of signals: resting or background activity, active muscle activity. This is the electrical activity that occurs in muscles when they are at rest. Normal resting muscle activity is typically low in amplitude and regular in frequency. Active muscle activity, this is the electrical activity that occurs when a muscle contracts or moves. Normal active muscle activity typically shows a pattern of brief bursts of high amplitude electric signal, which in turn we can see in the graph the difference between the raw wave, filtration wave, and rectification wave, smoothing wave, and root mean square wave, which we can detect the muscle activity, through which can detect the disorders, and we can give the diagnosis to the affected patient. Thank you.